Welcome to our presentation on PANS and PANDAS for school personnel. In this presentation, we will be discussing the impact of pediatric acute-onset neuropsychiatric syndrome, also known as PANS, and pediatric autoimmune neuropsychiatric disorders associated with strep, also known as PANDAS, in the school setting. This evidence-based presentation will share perspectives from parents and educators experienced in working with those with PANS and PANDAS to discuss their respective experiences. We are happy you are here to learn about PANS and PANDAS, as the symptoms can be difficult for educators to manage.
By the end of this presentation, you should be able to describe the symptoms of PANS-PANDAS, discuss the impact of these symptoms on school performance, recognize recommended educational interventions including accommodations, suggest 504, IEP, and individualized health plan accommodations for children with PANS-PANDAS, and locate resources to help you learn more and better serve children with PANS-PANDAS. Citations for information from research studies are noted on the slides. We want to state up front that we found the books PANS and PANDAS in the School Setting, edited by Dr. Patricia Rice-Doran, and PANS, Cans, and Automobiles, written by Dr. Jamie Candelaria Green, to be very helpful and have gathered many of the suggestions in this presentation from these books. Similarly, we utilize information from the PANDASNetwork.org Quick Facts Toolkit. This toolkit is available for free download and provides educational team members with ideas to help when working with a child with PANDAS or PANS in their classrooms. This presentation is intended for introductory information on PANS-PANDAS in the hopes of improving the educational experience for children with this condition. This is not meant to prescribe or recommend any specific treatment and is not an all-inclusive presentation. Also, Dr. Janice Tona is a senior author on this presentation and is a contributing author to the PANS and PANDAS in the School Settings book, which presents a potential financial conflict of interest since the book is highlighted in several slides. We ask that you do not reproduce this presentation without written consent, but you are able to reference this presentation and refer to others to view it. To begin our presentation, let's hear from Diana Pullman, Executive Director of PANDAS Network.
I want to take this opportunity to thank you for taking time to learn about helping children with PANDAS and PANS in the schools. As the Executive Director of PANDAS Network, I talk to many, many parents each day, and I know the challenges they face as they send their children to school. You, as school personnel, can make a big difference in these children's lives by understanding the unique aspects of PANDAS and PANS, and working with the families to support their child as they attend school. I'm excited for you to learn about evidence-based presentation, and I invite you to spend time on the PANDASNetwork.org website to view all of the resources we have to help children, families, and school personnel. Thank you so much.
And before we go on, I'd like to mention a few things that you might want to take a minute to download and refer to during the presentation. The first is the PANDAS Network Education Toolkit. This is a series of handouts for all the members of the education team that describes much of the information and summarizes a lot of the information that we'll be presenting today. The PANDAS Network Education Toolkit is available at pandasnetwork.org/education/. The handouts for this presentation can also be downloaded for you to take notes or refer back to during and after the presentation, and those are at tinyurl.com/PANSSchoolTeam, tinyurl.com/PANSSchoolTeam. You might want to take a minute now to pause the video, get the downloads that you want, and then resume.
First, let's welcome Dr. Christine Brown to tell us about the diagnoses of PANS and PANDAS.
Thanks, Jan. Pediatric acute-onset neuropsychiatric syndrome, or PANS, is a disorder that is characterized by a sudden onset of neuropsychiatric symptoms, including anxiety, food refusal, obsessive-compulsive behaviors, and a host of other sensory, motor, cognitive, and emotional changes following any infectious, environmental, or metabolic trigger. Under the heading of infectious triggers, pediatric autoimmune neuropsychiatric disorder associated with strep, or PANDAS, is an autoimmune disorder that includes a sudden onset of symptoms of obsessive-compulsive disorder, otherwise known as OCD, and/or tic disorders following a Group A beta-hemolytic strep infection. Group A beta-hemolytic strep is the type of strep that is usually seen in strep throat, but can actually occur elsewhere in the body and cause a range of disease. PANDAS was identified in 1998 by Dr. Susan Sweeto and colleagues. At that time, researchers also realized that many children could have similar symptoms as referred to earlier with other types of infections. However, researching strep was much easier because we already knew a great deal about autoimmune strep infections like acute rheumatic fever and symptoms chorea. Additionally, children with PANDAS in the 1998 study were reported to have an increase in symptoms when experiencing other illnesses. And by 2012, researchers came together to formally recognize the variety of infections, environmental triggers, and metabolic conditions that can lead to a sudden onset of these neuropsychiatric symptoms and termed this PANDAS. Therefore, PANDAS is a subset of PANS, even though PANDAS was labeled first and may be better known. So now let's talk about theoretical changes. The exact cause or causes of PANDAS are currently being studied, and more is understood each day by researchers studying humans, animals, bacteria, and viruses. The current theory suggests that some children are predisposed to having an autoimmune response, possibly due to genetics. It seems that repeated infections may also play a role in the likelihood of a child moving from a simple infection to having PANDAS. Research indicates that inflammation likely causes a breach in the blood-brain barrier and allows immune cells that are intended to fight strep or other infections to enter the brain tissue. Once in the brain, these immune cells are then believed to target neural tissue, which has a surface that is similar to strep or other types of infections in a misdirected immune response. This results in changes in the brain, including inflammation and changes in the balance of neurochemicals in these areas of the brain, and may be categorized as encephalitis. These changes appear to be particularly true in the basal ganglia, which is largely responsible for motor control, but may also include other areas of the brain. These neurochemical changes are believed to underlie the OCD, extreme anxiety, including separation anxiety, restricted eating, motor tics, urinary frequency, sensory defensiveness, sudden mood changes, handwriting deterioration, math dysfunction, and other problems seen during PANDAS exacerbation.
Thank you so much, Christine. Now let's turn our attention to two other related conditions. Two immune conditions that are related to PANS and PANDAS are immune deficiency and autoimmune encephalitis. One study of 687 families reported that slightly more than half of the children with PANS were immunocompromised, meaning they had fewer antibodies than most children and had difficulty fighting off infections. We also know that several studies have found that children with PANS have more frequent infections than other children. Therefore, it's very important that these children learn to take precautions to avoid germs and that the school personnel practice infection control and good hygiene. In addition, studies by Dr. Harry Chugani from Michigan and other doctors have shown enlargement of the basal ganglia of the brains of children with PANS and PANDAS. For these and other reasons, researchers are now identifying links between PANS and PANDAS and autoimmune encephalitis. Some doctors classify PANS and PANDAS as autoimmune encephalitis today, and the connection between these diagnoses is expected to increase with upcoming research. PANS is thought to affect as many as 1 in 200 children. To be diagnosed with PANS, the child must present with restricted eating or anorexia or a sudden onset of OCD. They must also present with 2 of the following 7 symptoms: anxiety, depression and or emotional lability, meaning mood changes that are disproportionate to the situation, irritability, aggression, and or severely oppositional behaviors, behavioral regression, which can vary widely and may include regression in play skills, reverting to earlier speech patterns, and possibly baby talk, and even returning to earlier motor patterns, with some children even regressing to crawling. Deterioration in school performance, with children having difficulty learning and keeping up with classmates, handwriting deterioration, and frequently deterioration in math skills. Sensory or motor abnormalities, which often include sensory defensiveness, with difficulty tolerating a variety of touch, smell, taste, visual, and auditory stimuli, in addition to difficulty tolerating movement. And then somatic signs or symptoms, which often include sleep disturbances and urinary frequency. The children feel like they have to go to the bathroom very often, though little or no urine may come out. These symptoms must not be better explained by a known neurologic or medical disorder, such as Sydenham's chorea, lupus, or Tourette's syndrome. Let's spend a few minutes looking at obsessive-compulsive disorder. Obsessive-compulsive disorder includes obsessive thoughts, which are very intrusive. And some examples of these are a thought that someone's going to hurt a child's family, or a thought that something bad will happen to someone they love if they don't do something a certain number of times, or a thought that they might become sick from germs if they eat food that someone else prepared. Some obsessive-compulsive disorders we see in children follow these common themes, although these are not the only obsessions that we can see. So some obsessions that we often see are obsessions with contamination. So the child might be very afraid that the food they eat might make them sick, or that something they encounter might make them sick. This makes it hard for them, for example, to leave the house or to eat a variety of foods. They may have an obsession with harm to themselves or to others. So they're very afraid to leave family members. They have a lot of anxiety about being away from people that they love. They want to check all the time to make sure that the people that they love are okay. They may have an obsession with symmetry. These are urges to have everything be equal. So, for example, if they bang their right hand on the wall, they want to bang their left hand on the wall. If they're drawing, they want to make something very symmetrical. They want to have two trees in front of the house on either side, not one on one side. They have to have things very balanced. You might see this. They may have symmetry urges in school. If something's not symmetrical on the wall, it may really, really bother them. Doubting. They often wonder if something really happened. Is this real? Did this really happen? Doubting if you like them, doubting if something occurred. So doubting, they may ask for reassurance a lot. They may have OCD around numbers, so obsessions with certain numbers. For some children, it's the number 2. For some children, it's the number 4. For some children, numbers, if older children may, have very complex patterns of numbers that they can't stop thinking about. Scrupulosity. This is one that we don't discuss a lot, but really affects a lot of children, and that's an obsession with religion or an obsession with, morals. So they're very concerned about, did I sin? Did I do something bad? They are very obsessed with thoughts about God, and religion is certainly not something we want to discourage in children, but this is beyond what we would expect for their developmental age. And then sexual themes are another obsession. And again, this is often beyond what we would expect for a child's developmental age, and it's not pleasurable to the child because they can't stop thinking about it. So, for example, we might have a younger child who is asking a lot of questions about sex that seem like the child's very precocious. And of course, when that happens, you always want to be concerned. We think about that a child may have experienced some type of sexual abuse, and that's something that we want to consider certainly, but know as well that in children with PANS and PANDAS, if there's no sign of that, it is often an idea that they just really obsess about. They can't get it out of their minds. And in older children, as they hit puberty, we start to see this become an obsession for many children with OCD. And, all children, I think, when they hit puberty have a lot of thoughts about sex that kind of comes with the age. But here we're talking about children who can't stop thinking about it. It's very intrusive. And it's not to the point of being pleasurable because they really don't want to think about it as much as they are, but they can't stop. So compulsions are urges to do things a certain way, often to overcome those obsessive fears, the fear of something bad happening that accompanies their obsession. The compulsion to wash your hands, for example, is an often cited compulsion, but many children demonstrate unique compulsions, including checking on things repeatedly, having to do things a certain number of ways, and the like. So let's look at some of these. Washing and cleaning is certainly a compulsion that we see in children where they want to be very clean. They may, repeatedly take showers. They may wash their hands often. They may want their desk to be very clean. Checking is a compulsion where children are, they might be continuously checking on things to make sure they're done correctly. Was the door locked? Are the lights turned off? Did I turn my homework in? Symmetry, as I said, can be a problem, and we certainly see symmetry compulsions with symmetry obsessions, and that may be that the child really needs to do things in a symmetrical way. Counting can be one. You might find that the child needs to do things an even number of times or needs to do things in multiples of 3. So those can be compulsions. Repeating and redoing. We certainly see this a lot in school where the child is wanting to repeat their homework, repeat their schoolwork. They want to redo things. Hoarding, compulsive act that we see. And, all children like to collect things. If there's a new stuffed animal that came out and there's 100 varieties of it, people want to collect them all. They want to collect all the, the toys that come in the McDonald's or the cereal box or whatever that is. That's what we're talking about here is really excessive hoarding, where they can't let go of things, and where they really need to hold on to things. For example, you might see there's some reports of children with PANS who hoarded things like garbage on the street, and they just bring it home and they name it and they can't let go of it, and they get really overly upset if it gets thrown away. So things like that can be problematic. And then praying can become a compulsive act, which would go with scrupulosity. So the child may feel the need to continuously pray and talk to God, just continuously for reassurance. Now in school, obsessive-compulsive behaviors that you might notice, the first is that the child may appear very stubborn or oppositional. And that's because they often don't want to talk about the obsessive thoughts they're having or the reason for their compulsive behaviors, or they may have compulsive routines or behaviors that they don't want to share with you. So they may just become very oppositional. And you think that you're, facing a stubborn child when in fact you're facing this child's obsessive thoughts and compulsive behaviors. And oftentimes those are stronger than the child's ability to overcome that and comply with your requests. So it's important to remember, if you tell the child they can only have one cookie and they say, I need to have 2 cookies or no cookies, they're not being nasty necessarily. That child may really feel like they need to have 2 of something. And so it's important to recognize those behaviors. When the child becomes very oppositional, stop and think about what triggered that, what happened before that oppositional behavior, and work with the team to really understand, if we're seeing similar things in different situations, maybe you can understand what that child's obsessions and compulsions are. The child may not even be able to understand it enough to verbalize it to you, but you can start to understand it a little bit better. The child may overfocus on neatness. Now, not all children do. Some children become very sloppy during a PANS exacerbation because of the ADHD symptoms, but you can also see children who can overfocus on neatness. They may line things up or arrange them repeatedly, want to redo their assignments. They want things to be perfect. They keep checking. They keep redoing. They may erase a lot. You may see a lot of holes in the paper from their erasures. When they're reading, they may repeat repeat words or the ends of words. Maybe you have them reading aloud and they repeat the sentence or repeat the last word of the sentence or repeat the last syllable of a sentence. You might see that pattern. You might see if you give them some type of a Scantron sheet or something like that where they have to fill in the blank or circle, that they're going to be very careful in doing that. They may go around and around and around repeatedly, sometimes till there's a hole in the paper. Their work may become very slow and deliberate, and that can result in incomplete assignments, which can also be very frustrating for them because they feel a need to complete something often. And then the checking. They're not sure. Did I turn my homework in? Did I turn my homework in? They might run up and check again. Did my homework get in the bin? They might check their backpack regularly. They might have a need to keep checking their locker to make sure that they locked it or something like that. Checking their pockets, checking under the desk, checking under the chair, ensuring the locks and zippers are fastened. So you might see this sort of repeated checking and a need for reassurance, and those can become very problematic. And it's important to stay calm and to recognize what the child's doing and to work with the team to determine the best way to handle that. And some of that's going to depend on the stage of recovery that the child's in. So it's important to all work together on that. And we'll be talking more about that. There are some diagnostic challenges with PANS and PANDAS. There are very few doctors who specialize in PANS and PANDAS, and it can take families a great deal of time to find the right doctor and get a proper workup. One 2017 study by Calabrese and colleagues found that patients waited for more than a year from their initial onset of symptoms until they were formally diagnosed, with many of them waiting over 3 years before receiving a diagnosis. A doctor really needs to do a comprehensive workup to rule out other disorders before diagnosing a child with PANS or PANDAS, and that can take time to complete. The Journal of Child and Adolescent Psychopharmacology published a consensus paper written by a PANS collaborative consortium in 2015 to help doctors with diagnosing PANS. Medical personnel are referred to that paper by Dr. Kiki Chan and colleagues for details. In addition to strep, infections frequently reported to trigger PANS include sinusitis, mycoplasma, which is a respiratory infection that is often seen as walking pneumonia, colds, as well as Lyme disease and other tick-borne illnesses. It's important to note that when someone is bitten by a tick or a flea or a mosquito, there are several different vector-borne illnesses that can be transmitted. And sometimes it takes families a while to figure out what the underlying infection is. So families can sometimes be working with doctors for a long period of time, getting a lot of different types of blood work to try to figure out if there's an underlying infection. Oftentimes there's signs that there's an infection, but they're trying to figure out exactly what that infection is. Examples of environmental conditions include exposure to allergens and mold, and metabolic conditions include disorders such as mitochondrial disorders. Another challenge when doctors are diagnosing PANS and PANDAS is that the symptoms do not always present at the start of the illness. Sometimes symptoms emerge several weeks after the illness as antibody levels rise and then the autoimmune process begins. Now let's talk about the range of symptoms. It's important to remember that PANS can vary widely in severity. PANS symptoms can range from mild to severe, with some children unable to perform daily tasks even with assistance. Additionally, the duration can last from a matter of weeks to a matter of years. Some children cannot attend school, and these children may need to receive homebound teaching for a period of time, and some parents choose to homeschool their children when they're not able to attend school. Some children also need to be hospitalized due to restricted eating, and so they need to be hospitalized so that they can be fed and the restricted eating can be managed, or because they are a safety risk to themselves or others. Hospitalizations may include an inpatient psychiatric stay for an indefinite period of time, and this can be very difficult for families because they don't know when the child's going to be able to come home, and so it's very, very hard for them to manage their lives and their concern, obviously, over the child who's been hospitalized. We need to recognize that PANS is not always a simple case. Sometimes the family and the doctors catch it early, the child goes on antibiotics, and the symptoms go away quickly. But other times, depression can become very severe, and it can include suicidal ideation and attempts at suicide. At least one study has indicated that children who are diagnosed more quickly and begin receiving proper treatment more quickly have fewer chronic symptoms over time. So it's very important that families get help for their child from a doctor who's knowledgeable in PANS. We also need to recognize that on occasion, PANS and PANDAS can cause severe brain inflammation. If a child ever becomes so intense in symptoms and the parents report repeated and increased psychological and neurological problems, the parents really need to contact a medical expert. As far as intervention for PANS, experts recommend a three-pronged approach to intervention. In 2017, the Journal of Child and Adolescent Psychopharmacology published a series of papers to help guide doctors in treating children with PANS and PANDAS. The guidelines were written by a collaborative group of doctors from across the United States. Dr. Susan Sweeto, who was chief of pediatrics and neuropsychiatry at the time of the writing at the National Institute of Mental Health, and Dr. Jenny Frankovich from Stanford University presented this three-pronged approach to psychiatric intervention, antimicrobial intervention, and anti-inflammatory and immunomodulatory intervention. These are some of the treatments you may see in children you work with who have PANS and PANDAS. Dr. Margot Tyneman from Stanford University and colleagues developed the guidelines for behavioral interventions. Children with PANS and PANDAS may benefit from behavioral therapy, including cognitive behavioral therapy, called CBT, with exposure and response prevention, called ERP. Studies by Storch and Murphy in 2006 and Nato and colleagues in 2015 found that children with PANS and PANDAS demonstrated improvement using cognitive behavioral therapy with exposure and response prevention, or CBT with ERP. It's important to note that the children in these studies all agreed to engage in this therapy, but they did all show overall improvement. Therefore, CBT with ERP may not be beneficial when a child's in an extreme exacerbation and not able to comply, but it should be considered as the child moves out of exacerbation to return to baseline and to help the child develop skills to manage future exacerbations. If a child you're working with is receiving CBT with ERP, the family may ask you to collaborate with the therapist for continuity in school. Some children with PANS and PANDAS are prescribed psychiatric medications and may find symptom relief with this, while others do not find relief and some experience a worsening of symptoms. Dr. Tanya Murphy from the University of Florida reports that some children with PANDAS require much smaller doses of psychiatric medication than other children their age and size, so you may see very small dosages prescribed if you're working with a child with PANS and PANDAS. The second prong of the three-prong approach is to treat underlying infection. Treating the underlying infection in PANS and PANDAS is an important component. Some children do very well with their first dose of antibiotics, while others may be prescribed several different options before finding one that works. Children may also be prescribed antiviral medications if the infection is viral in nature. The child may need to take antibiotics or antiviral medications during the school day, and if so, it's important that this is done at the scheduled time. This prong of antimicrobial treatment was developed by Dr. Michael Cooperstock from the University of Missouri and colleagues. The third prong is immunomodulatory treatment. Some children respond well to anti-inflammatory medications such as ibuprofen. Therefore, some children may be prescribed Motrin or Advil when their symptoms flare. If symptoms are more involved, children may be given a course of steroids to reduce inflammation and modify their immune response. In more severe cases, children may be given infusions of intravenous immunoglobulin therapy, or IVIG. IVIG is derived from donated human blood plasma, and it provides the child with a large dose of antibodies, which has been found to be helpful for relieving PANS and PANDAS symptoms in some studies. Children sometimes have headaches or other flu-like symptoms for a period of time after IVIG, and they may have difficulty attending school. In very severe cases, children may receive plasmapheresis, which removes antibodies from their blood to stop the autoimmune response. The doctor may want the child to be away from other children and germs for a period of time after this process. The immunomodulatory treatment section of this three-pronged approach was developed by Dr. Jenny Frankovich from Stanford University and colleagues. It is important to remember that all three prongs should be considered when intervening with children with PANS and PANDAS. No matter what type of medical intervention has been prescribed for the child you work with who has PANS and PANDAS, you want to be sure to let the family know if there is a change in symptoms. You may not be aware, for example, that the family is trying a new antibiotic, and your input can help them to know if the new medication is working. Many families find it beneficial to communicate daily with teachers via email or a notebook to rate symptoms and be alerted to changes in status that may signal a flare. PANS and PANDAS exacerbations are said to have a sawtooth recovery. A typical autoimmune response begins with an infection entering the body. Antibodies are then formed to fight off the infection, and in an autoimmune response, this triggers a sudden increase in symptoms. As the infection ends, the antibodies are removed and the body typically returns to baseline. However, when another infection comes along, once again we see a rise in antibodies and a return of symptoms to slowly return to baseline. Over time, this looks like the teeth of a saw. There is some evidence, however, that children with PANS may not return to baseline function. The symptoms may become chronic, meaning the body will continue to display some symptoms even when the child is not having an exacerbation. One study by Calabrese and colleagues in 2017 found that this was most often seen in children who have a delay from onset of symptoms to diagnosis and treatment, so early identification and treatment are important to avoid this. Now let's consider all that we've learned so far and look at this case study. There has recently been an outbreak of streptococcal infection at a local elementary school, and 7-year-old Josie was diagnosed with strep again. This is her third diagnosis of strep in the past 2 months. This week, she was sent to the principal's office twice due to aggressive behavior towards other students and an inability to be calmed down after the behaviors. She also started refusing snacks and lunches, saying she's afraid she will choke. In class, she covers her ears and cries that her classmates are too loud. Let's think about some questions and answers. Josie's parents should talk to her doctor about being evaluated for possible metabolic disorders, ADHD, PANDAS, oppositional defiant disorder. And the second question, which of the following symptoms would Josie least likely be experiencing? OCD-like symptoms, anxiety, hirsutism, which is excessive hair growth, or urinary frequency. So the answer to the first question should be PANDAS. It's probably not a metabolic disorder since this seems to be related to strep coming on. It's probably not ADHD since this came on very suddenly and she didn't have a history of these behaviors before. And oppositional defiant disorder is certainly a possibility given her oppositional behavior, but given the fact that she has this sudden onset of sensory problems and food refusal, it would be good for the parents to bring this to the doctor's attention and ask about PANDAS. Which of the following symptoms would Josie be least likely experiencing? Well, if this is PANDAS, she would very likely have OCD-like symptoms. She would very likely have anxiety. And we know that urinary frequency, the urge to urinate and sometimes even leaking and having accidents, nighttime enuresis, are problems during PANS exacerbations. But there's no evidence that there's excessive hair growth just from a PANS exacerbation itself.
Now, let's turn our attention to the impact of PANS-PANDAS exacerbations on home and school functioning.
Each child with PANS and PANDAS is unique and presents a distinctive set of symptoms that are different from other children and that may be different from one exacerbation to the next within the same child. PANS and PANDAS can lead to cognitive, sensory, emotional, and motor difficulties that can make completion of basic activities of daily living a challenge. For example, children may be unable to tolerate certain clothing and different types of food. OCD may lead the child to stop eating due to the fear of choking, resulting in anorexia. Children may experience a frequent urge to urinate or bladder and bowel incontinence. Sleep disturbances can also be experienced during exacerbations. Children may also have tics during exacerbation, and these can include motor tics as well as vocal tics, such as throat clearing or making sounds. These can be disruptive to the classroom, but all parties need to understand that these tics are involuntary, just as they are in children with Tourette's syndrome. Shown here are the results of a 2017 survey of 111 families of children with PANS reporting on the child's performance during an exacerbation. The green indicates no problems, and other colored sections indicate increasing difficulty with performance. Yellow indicates mild difficulties that most people would not notice. Orange indicates moderate difficulties requiring assistance or adaptation to function. and red indicates inability to function at a typical level even with assistance and adaptation. All areas were problematic for some children. About half of the children had difficulty with bowel and bladder control, mostly due to urinary frequency. More than 50% of the children had problems in all other areas, including eating, personal hygiene and grooming, handwriting, math skills, organized activities, community social participation, family social participation, free play, emotional coping, higher level thinking, and energy and drive. As you can see, emotional coping is a huge challenge for the vast majority of children with PANS, and most of the children could not function at a typical level even with assistance and adaptation, as indicated by the red line. In addition to the toll these symptoms take on the child with PANS and PANDAS, their loved ones and caregivers also face a great deal of stress and burden as they try to meet the child's needs. This includes family members, friends, and school personnel.
Play, leisure, and social participation are critical occupations for child and family development and functioning. These occupations are severely impacted during a PANS-PANDAS exacerbation. The stigma associated with this diagnosis can have a large impact on social participation, and PANS-PANDAS frequently include symptoms of separation anxiety and emotional lability that make it difficult for these children to interact with their peers. Peers often do not understand the change in their friend and may not be comfortable with their friend's tics or compulsive behaviors during exacerbation, making it difficult for friendships to continue to grow. There is a significant decrease in a child's ability to leave the home to participate in community and organized activities during an exacerbation as well. In 2019, Dr. Barbara Demchik and colleagues published a qualitative study of 6 families of first-grade children with PANS-PANDAS and found 6 themes that emerged among families. The first, life suddenly turned upside down, indicating the sudden onset of the disorder. One parent stated, "And overnight, it's literally like they woke up one morning and they won't wear the clothes they chose the night before, and they won't eat the food that they love. And they hate grandma and they hate grandpa, and they don't want to go to church, and they don't like soccer." The second, my child is not crazy. Parents reported that it was not uncommon for medical professionals to assume their child had a strictly psychiatric illness and treat it as such, or assume the parents did not know how to set limits and parent their children. When parents tried psychiatric treatments and limit setting alone, there was no improvement, and parents felt they had to prove that their child had a medical condition. One parent stated, "Don't automatically assume. We are bad parents. This was the first thing we got from everybody, that we are terrible people, terrible parents. It was horrible. The hurtful things were believed, even though I knew it wasn't true. But when professionals are telling you that, you have a tendency to believe them." The third, emotional distress within the family. Parents describe the emotional toll on their lives and the lives of their other children, and describe trauma during exacerbations and fear of return of exacerbations once the child is better. Next, major life alterations. Having a child with PANS-PANDAS really alters a family's life. It often results in financial difficulties due to medical expenses and decreased work, lack of sleep for the parent, inability to leave the house for shopping, doctor's appointments, and school meetings, lack of socialization for parents, and reduced intimacy. The last theme, which is the most important for this presentation, is school drastically influences family quality of life. Demchik and colleagues found that the ability of the school and the family to work together really influenced the level of stress and quality of life for the family. Some participants reported the school misinterpreting their children's symptoms, with examples like punishing a child for verbal tics and having children spend much time in handwriting remediation during an exacerbation when they could not control their handwriting. On the other hand, parents also identified that having a school that collaborated with them really relieved stress within the family, with one parent stating, "They sat down with me right before school started, and they had paperwork about PANDAS, and they were prepared for it, and it just made me feel better."
PANS and PANDAS leads to a significant deterioration in school function, as mentioned earlier. A 2017 study by Calabrese and colleagues found only 23% of children affected are able to perform adequately in a typical school setting without special accommodations during a PANS and PANDAS exacerbation. Problems often seen include handwriting deterioration, inability to attend school due to anxiety or other symptoms, low endurance and fatigue, emotional lability, separation anxiety, and restricted diet due to OCD, anxiety, or sensory problems. Additionally, PANS and PANDAS may have an impact on a child's attendance. They may have shortened school days and leave early or not attend school at all. Having a child attend school as much as possible helps them to maintain this very important occupation and reduces the amount of learning they miss. These changes are stressful for the child, the family, and the educational team. To date, there are no studies of the impact of having a child with PANS and PANDAS in the classroom on the school professionals, but certainly the fluctuations in emotional, cognitive, and physical functioning can be very difficult for school personnel and require a flexible and dynamic approach. It is important that all partners work together to weather the storm of PANS and PANDAS exacerbations in school in the best way possible.
Okay, so now let's have an application question. Let's look back at Josie again. Josie's family asked the pediatrician about PANS, and the pediatrician suggested that they keep a journal of unusual or regressive behaviors at home and school for 1 week. Which of the following would not be indications of PANDAS and PANS? Select all that apply. So which of these would not be indications of PANDAS and PANS? Recently refusing to eat a variety of foods, high blood sugar, having to urinate frequently, sadness or depression, handwriting deterioration, and low levels of calcium in the blood. And the answer is that high blood sugar and low levels of calcium in the blood are not typically indicators of PANS and PANDAS. However, we do often see a sudden onset of food refusal, frequency with urination, sadness and depression, and handwriting deterioration. We will now focus on the team that will be helping these children to be able to learn in school. I'd like to welcome Dr. Jody Duke, Associate Professor and Academic Program Coordinator for Autism in the Helen A. Keller Institute for Human Disabilities at George Mason University, to talk about some important members of the educational team. Jody?
The skills of the entire school team will likely be utilized when working with a child with PANS, PANDAS. This team should include the parents for the best coordination. Ideas on how various school professionals can effectively help children diagnosed with PANS or PANDAS can be found in the PANDASNetwork.org handout, Quick Facts for Schools. This diagram lists some of the common team members working with a child with PANS or PANDAS. It is important to remember that there are many other school personnel who work with children with PANS or PANDAS, such as school bus drivers, recess aides, and lunch monitors. These individuals should also be informed about any accommodations the child may need. Having all school personnel on the same page can help to create a more effective learning environment for the child. The principal and other administrators are important players who can set the tone for the entire team. Administrators coordinate and deploy the team and meet with parents to understand their perspectives and negotiate challenges between the child's needs and the school policy and procedures. Principals and administrators determine school-wide policies that can support the child with PANS, PANDAS, and increase the likelihood that the child will attend school. For example, one principal instituted a policy of calling a code yellow, alerting teachers to remain in their classrooms when one child with PANS was having a behavioral incident in the school hallway. This allowed the child to maintain dignity, as schoolmates were not witnesses to this period of emotional distress. Classroom general education teachers, special education teachers, special subject area teachers as well, such as art, music, PE, teacher aides, and paraprofessionals are all integral members of the educational team. General education and special education teachers are able to initiate and integrate support from specialists within the school environment. School educators are the ones who orchestrate the various classroom accommodations for children with PANS, PANDAS. They often understand the child's anxieties best and can identify triggers that may lead to emotional difficulty. The classroom team can facilitate peer interactions between children to create an inclusive environment for those who may be experiencing social anxiety and other PANDAS symptoms. Educators can be the first to recognize as well how the symptoms of PANDAS may affect a child's participation during the school day, and they should communicate frequently with the family. Finally, the classroom teacher is instrumental in practicing good infection control policies and procedures in the classroom and decreasing the risk of infection spreading. In addition to supporting the team and families of children with PANDAS, school psychologists need to be aware of PANDAS, as the cyclical nature of the disorder can skew standardized tests, and psychologists should understand if the child's having a flare at the time of testing. Gamucci and colleagues recently found PANS neuropsychological deficits in visual motor abilities, short and long-term memory, and processing speed in children with PANS, and even found differences between children with PANS and children with PANDAS. School psychologists should keep abreast of current research as more information is learned about children with PANS and PANDAS. School counselors and social workers are an integral part of the team that can understand and support the child who is facing sudden changes in thought processing, such as obsessive thoughts and a need for compulsive behaviors. School counselors can become educated on PANDAS and can help to educate team members about the child's challenges. They can work with the team to determine appropriate accommodations and can provide a safe space for children to talk about their thoughts and feelings. School counselors can also support families as they grapple with the changes in their child. As children move forward, school counselors trained in cognitive behavioral therapy with exposure and response prevention may find this technique beneficial for the child, as noted by Nadeau in 2015. Finally, school counselors can support siblings who may be experiencing trauma while witnessing their family member with PANDAS.
Thank you so much, Jody. That was very helpful. The school nurse plays a very important role when working with children with PANS and PANDAS. Here's school nurse Kathy Teal to tell us more about this role.
Hi, the school nurse is often the very first person to recognize the link between illness in the child and the child's behavior. The nurse also has access to information about illnesses among other children in the school, which will be very helpful with the PAN and PANDAS diagnosis and how they can interact in the school setting. School nurses and educators often see symptoms and manifestations of PANS that are not seen at home and vice versa. We are in a unique position to identify abrupt changes, new symptoms or behaviors previously overlooked, which can be a crucial part in diagnostic criteria. We have these students year after year, so we know them, their families, and their situation. A lot of times they get sick and they go to see whoever's on call, or whoever is their primary care doctor can't see them, so they go to a minute clinic. And there's no place where all of these records are kept in an organized fashion. So it's hard to really track some of these illnesses. But at the school nurse, you have the children for so many years. And every school nurse uses electronic medical records. And when you have those records, you can track this information. So there's many different aspects of the school nurse and the very important role that she can play. The school nurse can initiate a support team to help the child, and this team should include the parent, the teacher, any support staff, and hopefully the physician who's working and treating the child. Open communication between everyone is very, very important because symptoms change. Children end up having flares or setbacks that everyone on the same team can make sure that that child is successful as possible in the school setting. Another thing that a school nurse should really do is educate herself about PANS and PANDAS. We have the ability to access all sorts of medical information. There's plenty of information on the internet. There's organizations that are very involved in completely PANS and PANDAS and autoimmune encephalitis related websites that are available to everyone, and most of these will be listed at the end of this presentation. So if we can share the information with the team players, especially the teachers that work with the students, that is very helpful. Another thing that we need to do is try to control infection in the classroom. These children are very, very susceptible to having a flare or a setback where they go back to their original symptoms once they're exposed to germs or other infections that pass around in the system. We know, especially in the elementary school, there's no 16 inches of personal space, and so these children will get very sick. And this is where it comes very handy to have that communication with the parent and with the teacher and other parents in the school setting by having people report the incidence of illness. You can send a simple letter out in the beginning of the year asking for parents to notify you if there's a child that's been diagnosed with strep or pneumonia. And many of these infections that these children have don't really affect maybe 3 or 4 other kids that are sitting around them, but that one child, it can devastate the rest of their school year. So it's important to share that information, and it does not cross any boundaries of any HIPAA laws. On the list here, it also talks about tracking the frequency of strep and other illnesses among students, and this is what I had mentioned about our electronic medical records. The software that almost every school nurse has, the similarities are that you can track the incidences of these illnesses, and you can go back 3, 4, 5 years in a row. That situation happened to me one time with a student who was acting very just not himself at all. He was a 5th grader, and he was just overnight speaking out in class and being silly and being emotional and having crying fits, etc. And it didn't seem to make any sense. And when I went back and looked at his record, he had had a really bad case of Lyme disease about 4 months prior to that. And it was bad to the point where he had the Bell's palsy on his face, and he was treated with antibiotics for a long time, but obviously not long enough. So that tracking of the illnesses is really helpful for you to have an idea of what the source could be of a new infection or a new setback. The patient also has different protocols depending on what their diagnosis is. Lyme disease with autoimmune encephalitis presents sometimes a little different than the strep and the mycoplasma pneumonia. Don't forget that some of these children also have these infections that are occur from just having staph infections and impetigo. And sometimes, in some situations, the children have been tested positive for rectal or anal strep. And that is something that's really not discussed very much, but it's not uncommon. So another role that the school nurse can have is make sure that you know that if the child has been tested positive and put on antibiotics, that you follow up with the parent to make sure the parent follows up with the pediatrician. These families are so busy that they don't even think that they have to go back to make sure that the infection was resolved. But these children, these recurrent infections, really will make a negative impact if they're neglected to be diagnosed again. And then the last thing on here is something that I've seen for over 20 years. One of the first symptoms is the teacher coming to me complaining that the child goes to the bathroom so many times during the day. It's such a red flag. And this will put a little red flag in the back of my head. So I'll start looking into things a little bit more seriously. And the parents, if there is a child that has strep or has a UTI, the parents need to know, because that needs to be treated, and that can throw the children off. So if they start using the bathroom frequently, it is very similar to having a UTI, that feeling, that sensation that you have to go and hardly anything comes out. So this autoimmune encephalitis that's affected by all sorts of different infections in our system can create havoc. And with our children, the sooner we find out what's going on and recognize this and get them to the right people, the better an outcome for their longevity and for their future prognosis.
Kathy, thank you so much. That was very helpful. Now let's listen as the occupational therapy graduate students tell us about some other members of the team.
Occupational therapists are frequently called upon for evaluation and intervention with children with PANDAS due to sensory processing changes and handwriting deterioration. It is not uncommon for children to receive an OT referral before receiving a PANDAS diagnosis. OTs should be aware of PANDAS and should talk with families about speaking to their doctor about this diagnosis when sensory issues, handwriting deterioration, urinary frequency, restricted eating, and cognitive decline appear to have a sudden onset, especially if they are also seen in the context of an infection or if the symptoms decrease with antibiotics. OTs can use standardized sensory, motor, and functional assessments to establish baseline data and then repeat these measures periodically to document changes over the course of treatment. Sweeto, Leckman, and Rose recommended using handwriting as one way to measure exacerbations and return to baseline in their 2012 article introducing PANS. Consultation with the teacher and the team to modify the sensory environment and to use energy conservation and work simplification techniques can help the child to remain in the classroom as long as possible during an exacerbation.
Students may have a deterioration in motor function, muscle tone, muscle strength, endurance, and gait, making it difficult to navigate in the school and participate in physical education and other activities. To date, there are no published studies or reports to guide physical therapists when working with children with PANDAS, but these school personnel have much to offer, especially as a child moves out of exacerbation and returns to function. Physical therapists should assess and provide intervention as needed, for example, for strength, balance, posture, and gait.
Children with PANS and PANDAS may develop sudden onset of changes in speech patterns, such as stuttering and disfluency, decreased use of language, including selective mutism, as well as simplified language structures, decreased tolerance in auditory input, auditory processing problems, social isolation, and decreased executive functioning skills. Speech-language pathologists can monitor for disfluency and can utilize assistive technology such as audiobooks to help with reading fluency and visual attention, and also visual schedules for children with auditory processing problems. Children may also be challenged by stuttering, and speech-language pathologists can help with interventions for this area. Speech-language pathologists can also encourage the use of communication devices to help with selective mutism and stuttering. Speech-language pathologists may find ideas in a 2015 ASHA blog entitled Study Up on PANDAS, a little-known disorder with big effects, by Melanie Potok. A link to this and other references is provided at the end of this presentation.
Now it's time for another application question. As we do these application questions, please remember that Josie is just one example of a child with PANS or PANDAS. Certainly there's a wide variety of causes of PANS and PANDAS. It can be a variety of infectious triggers, and there are also a variety of presentations regarding severity and duration. So just keep that in mind as we talk about Josie. It has now been 2 months since Josie was diagnosed with strep, and she just had an appointment with a PANDAS specialist last week who diagnosed her with PANDAS and started her on medication yesterday. Over the past 2 weeks, the teacher has noticed that Josie no longer plays with her peers during recess, and when she does try to play with her peers, she's not able to keep up. She also has frequently missed school, and when she is present, she tends to leave early because she constantly misses her mom or she has to go to the bathroom often. Her handwriting is nearly impossible to read, and she keeps falling in physical education. On top of that, she has just started to stutter. The educational team has now set a meeting to discuss the recent changes in Josie. So who is likely to be included on Josie's education team? Her teacher, the school nurse, the school counselor, the occupational therapist, the physical therapist, the teacher and school nurse only, or all of the above? The answer to this is all of the above, and depending on the severity of her illness, it may also include the principal or administration, and it could also include a special educator if she has an IEP and is receiving special education, and of course the school psychologist if needed. Now we'll turn our attention to educational intervention for children with PANS and PANDAS in the school. We are so happy to be joined by Dr. Patty Rice Doran, Associate Professor of Special Education at Towson University and editor of PANDAS and PANS in the school setting. Patty?
Thank you. I'm really delighted to be part of this. Now we will share a little bit about intervention approaches to support students with PANDAS and PANS in the school setting. Trying to improve underlying ability in the midst of an exacerbation can be frustrating and fruitless for the child and the educational team. Most experts agree that students need to receive accommodations for their symptoms during periods of exacerbation. This might include, for example, modifying activities or adapting the environment to make it easier for the student to participate. As symptoms decrease, the educational team can move toward remediation and rehabilitation models to improve the child's skills so that the child can complete activities in a more typical fashion and in a more typical environment with the goal of returning to baseline functioning. It is important to minimize any loss of skills between exacerbations. Accommodations. Accommodations are important because they can help the child with PANS and PANDAS to attend school as often as tolerated during exacerbation. However, the child's needs may vary from day to day, so it is best to have a menu of accommodations that the child and teacher can select from each day based on the needs on that day. Some examples of accommodations include giving the child a laminated pass to use the restroom as needed, or a laminated pass to go to the guidance office as needed. If there is a concern for the child's safety or the safety of others, this should be accompanied by a policy of having an aide escort the child. Some teachers establish a signal with students, such as having the child move a pencil to a particular spot on a desk, in order to let the teacher know the child needs a break or needs support without garnering unwelcome attention from classmates. Children may also be accommodated by allowing preferential seating, whereby the student is asked where they would like to sit, such as near a door or near a window, and honoring that when possible. It is important to note that accommodations should only be used as necessary, and the goal is always to decrease and eventually remove accommodations if they are not needed as the child's function improves. Some children may require long-term accommodations. Many children may not, or may be able to significantly decrease the accommodations needed in between periods of exacerbation. Determining when a child needs accommodations and what those might be is an important process requiring teamwork, trust, and communication between school personnel, parents, and, when appropriate, a student's healthcare team. Dr. Amy Mazur presents many excellent ideas for academic accommodations and supports in the 2017 book, PANDAS and PANS in the School Setting, a handbook for educators. Fatigue. Fatigue is often reported during a PANDAS or PANS exacerbation and can further limit a child's involvement in daily life. This may be due to the condition itself or it may be due to sleep disturbances. Offering rest breaks throughout the school day may help to increase children's participation in academic tasks. It may also be beneficial to incorporate movement-based activities into the day during low-energy times in order to help energize children for increased participation. Children with PANS and PANDAS can also benefit from energy conservation techniques during times of exacerbation. Some examples in the classroom include placing frequently used items in easily accessible locations, adjusting desks so the child is facing forward and does not have to adjust their body to see the teacher, utilizing a rolling book bag, incorporating rest breaks throughout the day, and eliminating unnecessary steps and tasks. OT and PT school personnel can help teachers develop individualized energy conservation plans. Teachers can prioritize classwork and homework so that the child completes the most important work first before becoming fatigued, and allow the child to reduce the amount of work required according to energy levels. School staff can also help to educate parents on proper sleep hygiene, but they need to recognize that the needs of the child with PANDAS and PANS are unique. Referring families to specialists in the community who may be able to help with sleep can be a good option. Those specialists should become familiar with PANS and PANDAS before beginning intervention. Classroom environment. There are multiple ways teachers can modify their classrooms to adapt for children with PANS or PANDAS during exacerbation. Utilizing universal design for learning helps all learners succeed by expressing ideas through multiple means of learning, such as visual, auditory, and tactile. Tailor the learning method to your particular class needs and the needs of your students. If implemented correctly, this can reduce the number of complicated accommodations and adaptations that you need because accessibility is built into the curriculum. Changing the classroom environment physically can promote learning. It can be beneficial to provide emotional warmth and safety within the room, such as making sure the room is friendly and engaging. For example, having sufficient blank space on walls and appropriate lighting can be productive and can reduce student stress. Seating arrangements may also be something to consider. Having 4-seat tables can be detrimental as it can expose children to potential illness or infection when classmates are sitting directly across from them. U or V-shaped seating designs allow for multiple partnerships and group work and are beneficial for children with PANS or PANDAS. Testing and workload accommodations, such as extra time, alternate methods of access and completion, distraction-free settings, use of technology, and use of note takers, can allow some children with PANS to continue participating in the classroom setting despite their symptoms. Dr. Darlene Fuster and I present additional information on universal design and adapting classroom environments for students with PANDAS and PANS in the book, PANDAS and PANS in School Settings, a handbook for educators. Modify class activities. Children with PANS and PANDAS may have difficulty with visual perception, especially spatial perception. Providing handouts with visual cues, larger margins, and bold print can facilitate visual differentiation. Writing prompts and graphic organizers can be used as language supports. Visual schedules, written schedules, and providing structure regarding transitions can help to reduce students' anxiety. Additionally, giving the child latitude to make choices whenever possible can reduce anxiety and oppositional behavior and may help the student feel more in control of the educational process. Providing alternative routes for responses, such as using visuals or pointing to the correct answer instead of responding verbally, can be beneficial in addressing a student's social anxiety. Finally, modifying the sequence of activities in the day can benefit children with PANS and PANDAS. Incorporating movement and exercise within the classroom is important. For example, providing sensory stimulation of small muscle movements by using a stress ball allowing the child to read lying down on their tummy on the floor, or having children walk around or take a stretch break before completing seat work. All can allow for exercise and help refocus the student's brain. Ready.
Thank you so much, Dr. Doran. That was very helpful. We're going to turn now to more accommodations in the classroom, and our occupational therapy graduate students will share some information with us.
Children can be easily distracted or become upset due to sensory defensiveness during exacerbation, and this can vary from day to day. Teachers and other members of the team can work toward identifying sensory triggers for individual children. Most have issues with aspects such as clothing, food, and everyday smells and noises. The team can look at modifying the school environment by decreasing sensory input for the child via noise-canceling headphones during free play or focused work. Offering gloves for sticky activities such as finger paint or clay can help the child to participate in the activities without distress. Reserving a quiet space in the room for the child and giving the child permission to use that space as needed can help the child to self-calm within the perimeter of the room. The lunchroom can be particularly chaotic and is frequently a source of sensory overload. Providing a quiet alternative space for lunch may help some children with PANDAS to remain in school for the day. Similarly, standing in line to move between classrooms is difficult for children with sensory defensiveness, as light touch from classmates behind them can be very distressing. It may be best to have the child with PANDAS be the last child in line, with a classroom aide positioned well behind the child to decrease unexpected input during this transition time. Some children present with restricted eating, which may be due to inability to tolerate the sensation of foods. Occupational therapists or related service personnel can analyze the food choices for patterns of sensory preferences and accommodate the child's sensory needs during exacerbation with a wider variety of choices with similar sensory characteristics. As the child moves away from exacerbation, the sequential oral sensory, or SOS, approach to feeding is one method that may work toward increasing tolerance to a wide variety of food. Many children with sensory defensiveness experience an increase in symptoms with light touch or when touching wet or sticky items. It would be best to use firm, even pressure if you want to touch the child. Additionally, children experience a decrease in symptoms when engaged in heavy work, such as carrying books across the classroom or pushing a library cart, and also when experiencing deep pressure. It is not recommended that teachers utilize items such as weighted vests or weighted blankets without an occupational therapy evaluation and consultation. For this accommodation, you can work closely with an occupational therapist to individualize the child's sensory diet. A sensory diet can include these and other activities for calming, which the student can use throughout the day. Thanks.
Children may not be able to participate in physical education due to low endurance. Children may also experience social isolation and may be unwilling to interact with other children during phys ed. Children with PANDAS may realize that their athletic skills have deteriorated, but they may not be able to verbalize this and may become upset. Talking with a trusted adult, including a teacher or counselor, can help the child to understand this temporary setback and encourage the child to participate to whatever extent possible. Many aspects of phys ed include teamwork, and it is important to make children with PANDAS feel included. Providing rest breaks during the phys ed class may allow children with PANDAS to become less fatigued and therefore able to participate. To provide a more inclusive session, PE teachers can also try to modify their lesson plan, keeping in mind the fatigue and isolation a child may be feeling.
Dysgraphia, or a deterioration in handwriting, is experienced by the majority of children with PANDAS. Legibility of handwriting can be a window to the child's level of PANS exacerbation, so it is important to keep samples of the same handwriting test or assignment before, during, and after exacerbation. Teachers can keep samples of the child's classwork for comparison over time. In these samples, you can see a 7-year-old child's handwriting when he was not in exacerbation on the left, and 2 months later, when he had a strep infection on the right. Notice the difficulty with letter formation and spacing. And in these examples, you can see margin drift on the left, whereby this 8-year-old started near the margin in line 1 and then drifted over toward the center of the page as each subsequent line was started, and then realized this and overcorrected toward the end. The paper on the right was by a 7-year-old child who is experiencing OCD. Notice the excessive erase marks, redrawing, and coloring in of openings. Occupational therapists can provide handwriting reassessment using formal measures such as the Minnesota Handwriting Assessment or the Test of Handwriting Skills. Compensatory strategies for handwriting may be beneficial during exacerbation, while remedial strategies are better during remission. Writing utensils, like a twist and write, can help if a child has difficulty maintaining a proper grip on the pencil. Children often have difficulty with spacing of letters during PANDAS exacerbations. This can be seen as margin drift, where the child starts the first letter of each line slightly to the right of the previous line, resulting in a diagonal margin. It can also be seen in letters being too close between words or too far apart within words, making the writing difficult to understand. Vertical line templates can be helpful during exacerbations to aid in spacing letters. Simply print a page of dark lines on a sheet of paper in landscape format. Once printed, turn the page to portrait format and place it behind standard horizontal lined paper. The vertical lines in the background combine with the horizontal lines in the foreground form a grid, and the child is taught to start with the first box of each line. Place one letter in each box and skip a box between words. Once completed, the vertical line template is removed and the child's writing is easier to read.
Students may experience regression in math skills during exacerbation, so checking up on their work informally throughout assessments can be beneficial to make sure they are on track. Accommodations can include providing a calculator and an opportunity to redo work for that child. A child with PANS and PANDAS may benefit from having math problems presented with limited visual stimulation. For example, placing only 2 to 3 questions per page to not overstimulate the child can lead to better performance and attention to the task. Additionally, decreasing the number of problems required for classwork and homework can make it possible for the child with PANS PANDAS to complete assignments and show mastery without excessive frustration, as problems may take too long to solve. Using graph paper or providing math problems in table format can help students to keep numbers aligned despite dysgraphia, and some students can benefit from talk-to-text technology or a scribe. Offering frequent rest breaks during math sessions can be beneficial. Allowing a child with PANS PANDAS to take a quick walk or squeeze a stress ball can allow them to get sensory input that may improve their ability to attend to the task.
Okay, so now it's time for another application question. Based on what you've learned, which of the following accommodations are most appropriate for Josie? Using a vertical line template behind her paper, providing rest breaks throughout the day, adding 10 points to all of her papers to ensure her grades do not suffer, provide a laminated bathroom pass to use as needed, recommend that she eat lunch in the nurse's office, create a behavior chart so she can earn television time when she goes home if she does not use the bathroom more than twice per day. And the responses that we came up with were use a vertical line template behind her paper because she's having trouble with spacing, provide rest breaks throughout the day to help her with her energy level. We wouldn't necessarily add 10 points to all of her papers to ensure that her grades do not suffer. It would be better to decrease the amount that we expect from her and to expect a reasonable amount for what she's able to do rather than just artificially bumping up her grades. We would provide her with a laminated bathroom pass so that she could use the bathroom as needed because it seems that that's still something that is problematic for her. And we might want to recommend that she eat lunch in the nurse's office. Of course, we wouldn't want this to be punitive, but that might be something that Josie and her family would welcome. So eating lunch in a quiet place might be something that she would enjoy doing. And creating a behavior chart so that she can earn television time when she gets home if she doesn't use the bathroom more than twice per day is probably not a good thing because physiologically she needs to use the bathroom, and we know that that's part of the symptomatology with PANDAS and PANS. So withholding television time because somebody needs to use the bathroom is trying to use a behavioral approach to solve a physiological problem. And at this point, since she's still in exacerbation, that would probably not work and may do more harm than good.
And now, Dr. Jamie Candelaria Green, learning specialist, researcher, and author of PANS, CANS, and Automobiles, a comprehensive guide for helping students with PANDAS and PANS, will join us as we consider the ways that PANS and PANDAS can present in education plans. Jamie?
This table shows 3 of the educational plans that can be used for students with PANS and PANDAS. The Individualized Education Program, or IEP, is a federal program for children with identified disabilities. This is for children who require specialized instruction, and it includes accommodations, modifications, and related support services like OT, PT, and speech therapy. IEPs also include plans for transitioning to post-secondary settings for children over 14 years of age, and they are part of the Federal Individuals with Disabilities Education Act, or IDEA. IEPs are developed for each individual child and are applicable from one school to another if the student changes schools. Now, let's think of the 504 plan. The 504 plan is a civil rights law to prevent discrimination. 504 plans are not covered through federal funding, as IDEA is, and if the student moves to a new school, the former 504 plan is reviewed and redeveloped as needed. Students must meet criteria for a disabling condition that is said to interfere with a major life activity to receive 504 plans. 504 plans do not provide special education, but they do provide accommodations, supports, and services for students to participate in the school environment, which also can include on field trips. Many children with PANS and PANDAS have individualized healthcare plans, or IHPs. IHPs consider how to manage the issues that may arise in school due to the child's health condition. They also identify the responsibilities of the nurse, school personnel, and others in carrying out the IHP interventions. IHP interventions are ideally based on a thorough school nurse evaluation. For children with PANS and PANDAS, school nursing services may include things like ensuring that the child's medication routine is followed in school, notifying the family of strep or other illnesses, and providing contact information for related organizations and governmental agencies that can be helpful in the care of the student. It may also include close collaboration with related healthcare practitioners and other individuals who provide support. Please note, however, that the school must have parental permission to talk with health providers or others about their child. As noted at the start of this presentation, the book PANS, CANS, and Automobiles and the book PANDAS and PANS in the School Setting, an Educator's Handbook, provide detailed information on these plans. An expanded review of the critical importance of the school nurse in the care of students with PANS can also be found on my website. Education plans. PANS and PANDAS can require extensive medical care, and children often miss school for appointments. Additionally, some children are not able to attend school for all or part of the day during exacerbation. One large-scale study found that 35% of children with PANS miss school for at least a week during exacerbations, and 9% were homeschooled during the exacerbation period. In these cases, transitioning back to school can be difficult. Creating accommodations for the child in the classroom and creating a modified attendance policy can help this child return to school for partial days or partial weeks with the goal of returning to school full-time. Most children with PANS and PANDAS fall under the disability category of otherwise health impaired, and they may also have additional diagnoses such as autism or a specific learning disability. Students with PANS and PANDAS may have IEPs, 504 plans, and/or individualized healthcare plans to provide accommodations for their illness. In addition to the functional accommodations for schoolwork and classroom modifications noted above, students may require accommodations for medical absences, and these attendance issues can be addressed in the IEP, 504, or individualized health care plan. Parents and educators can find detailed information about what to expect when developing each of these plans in my book, Pans, Cans, and Automobiles. Accommodations for shorter medical absences in these plans may include online discussions, recording lessons for later viewing, and electronic notes or FaceTime. Also, selecting a class note taker who will share their notes with others in the classroom, as well as providing lecture notes and a lesson outlined to the student with PANS, can be an effective alternative when a child cannot attend school that day. Families may also consider hiring a tutor or study buddy to help the student stay on track with his studies during this time. Many students who are not able to attend school for longer periods of time due to PANS or PANDAS receive home instruction, sometimes called home hospital instruction, whereby teachers from the school district come to the home to provide education to the child. It is important to let the child know that they are a part of the classroom and that you want them to be as much a part of the activities and learning as possible. This includes participation in their favorite extracurricular activities too, such as sports teams, music lessons, chess clubs, and scouts. In some cases, children are not able to attend school for a prolonged period of time, or they may become sick very often due to germs in schools, and many families choose to homeschool their children. Older students may also take online classes to continue their education when not attending formal school. However, they may still require assistance from a tutor or others to help them initiate, keep track of, and complete their work.
In order to help you access the references used for this presentation and resources that may help you or a family, we have posted a reference list and resource list at tinyurl.com/pansinschool. Keep this URL handy and refer to it when needed. You can also share this with families or others who may find the information beneficial. Thank you for taking the time to watch our presentation on PANS and PANDAS for school personnel.
Hi, this is Dr. Jan Tona. I am the Occupational Therapy Program Director at the University at Buffalo and a member of the PANDAS Network Working Group on Educational Access. I want to take a minute to thank the occupational therapy graduate students who worked really hard for over a year to develop this training session. They're pictured here, and they are Sydney Allen, Nicole Checky, Ashley Monaco, Caitlin Owens, and Kaylee Zidell. They're all practicing therapists now and doing great things in the world. I also want to thank the members of the PANDAS Network Working Group. This group worked for several years, really, to put together the toolkit, and then all contributed to this training session. And several members, as you saw, also contributed their voices to help narrate the sections that they worked so hard in helping to write. So I really want to thank all the members of the PANDAS Network Working Group on Educational Access. And of course, I want to thank Diana Pullman, Executive Director of PANDAS Network, for all that she has done to help to move this project forward. Before we part, we're going to ask you to take a few minutes to complete this online survey to provide feedback and help us to continue to improve our training. If you can go to www.surveymonkey.com/r/PANS2021 surveymonkey.com/r/PANS2021 pilot. If you could go there and take a brief survey and provide us with feedback on this training, we would really appreciate it, and it will help us to continue to make this a better and better opportunity for educators to be able to help children with PANS and PANDAS. Thank you so much. Have a great day.